Hello again. It is time for another session. This time, it is the clinical examination of the motor system. As with any other clinical examination, it is worthwhile repeating that the basics of clinical examination must be observed at all times. Observation starts when the patient or volunteer walks towards you. Look for the gait, how they walk. Look for the build, and if there is any obvious muscle wasting or hypertrophy. Abnormal movements like chorioathetoid movements and hemibilismus can be picked up at this stage. Please also note that examination of reflexes is a part of motor system examination, but is explained to you separately to account for time. Romberg's test is not a part of motor system examination, but for your purpose, it is being shown as part of cerebellar function testing. Let us begin with the motor system. First off, we look for the bulk of the muscle. We inspect for any obvious differences between the two sides, or if both sides show any atrophy or hypertrophy. Then, to measure the bulk, we select any one segment of the limb. We select a bony point. In this case, it can be either the shoulder or the elbow. Look for where the muscle has maximum bulk and measure from the bony point to the place of the maximum bulk. And at that level, we measure the girth of the limb. And then we measure the girth of the limb on the other side at the same level, same distance from the same bony point. Next, we assess the tone of the muscle. The textbook definition of tone is a partial state of contraction of muscles, even in the resting stage. However, when examining, this cannot be appreciated easily. Instead, we look for the resistance offered by a muscle when its antagonistic muscle is passively contracted. Observe in the video how first the looseness or tightness of the muscle is being felt, and then the elbow joint is being passively flexed with no effort from the volunteer. While the passive movement is going on, the shortening of the biceps is being felt and the resistance by the triceps is being assessed. Power of muscles is assessed for each individual muscle or for movements across a joint. The volunteer is asked to perform a particular movement while the examiner applies resistance against that movement. Remember to apply the resistance as distal to the fulcrum, which is the joint, through which the movement is being performed, without crossing over the next distal joint. For example, As shown in the video, when testing the power of the biceps, the volunteer flexes the elbow joint while the examiner applies resistance over the volar aspect of the forearm, just proximal to the wrist joint. Test all the muscles in a particular limb on both sides. Test both upper limbs and lower limb. Coordination of motor activity can be tested with the cerebellar function tests. Demonstrated in the video are the finger-nose test, the finger-nose-finger test, the heel-knee-shin test, and diadochokinesia, that is rapid alternating movements. Gait testing, part of this series, is described in the next video. Testing of gait is conducted separately, apart from the initial observation described in the first video. It includes a casual walk as well as tandem walking. Gait not only gives information about coordination, but an abnormal gait, if present, can be an indicator of a disease process. Observe and describe the exact type of gait, including the normal arm swing during walking. Romberg's test is performed with the volunteer standing upright, looking straight ahead, with feet together and upper limbs hanging loose by the sides. The volunteer is asked to stand with the eyes open and then close the eyes and stand for about a minute. Minor swaying with the eyes closed is not considered abnormal, but a greater degree of swaying, often irregular swaying, or a fall, or a near fall, is a positive Romberg's test. Take special care to stand close to the volunteer when this test is being done. Be ready to hold him or her in case of a near fall, or else your patient or volunteer might suffer injury. Much like the grading of reflexes, power of muscles is also graded. Grade 5 is full power, that is, when the individual can perform all activities and lift normal weights. Grade 4 power is when the muscle can perform a movement against resistance offered by the examiner. When resistance cannot be overcome, but the movement can still be performed without resistance and against gravity, the power is grade 3. If the movement cannot be executed against gravity, then it is attempted with gravity eliminated. If it is done, then the power is grade 2. Sometimes only a flicker of movement is seen and it is designated grade 1 power. And finally, grade 0 power is when there is no movement at all. One must look for abnormal movements all the time. Make it a part of your habit of observation. While gross abnormal movements like the chorioathetotic movements, melismus, or gross tremors can be obvious, one has to carefully look for tics and fasciculations if suspected. Also, check for fine tremor as shown in this video.